Health disparities refer to the preventable health disadvantages of certain communities. Someone may be impacted by certain health disparities based on their gender, sexual orientation, socioeconomic status, race, or location. Underserved communities of men include gay, bisexual, or transgender men, men of color, men who earn low incomes, and men who live in rural areas. All of these groups are at a higher risk of developing health issues due to systemic problems like racism, homophobia, and classism. The Affordable Care Act, National Suicide Hotline, as well as state and federal lawmakers have implemented policies to try and address these disparities. African American men are disproportionately affected and killed by kidney disease when compared to other populations. End-stage kidney disease is 4 times higher in black men than it is in white men, 10 times higher in young black men ages 20 to 44 than in white men of the same age range. This is because of the racial inequality that can be seen across the healthcare field. People of color have less access to higher quality care and are often more likely to be uninsured. These reasons contribute to why black men make up such a large portion of all people that are in the ending stages of kidney disease. Researchers have also found that black men living in black communities are at a higher rate of hospitalization and mortality. This is a result of residential segregation and the lack of support that black communities have. House Bill 21-1171 from the Colorado General Assembly addresses this disparity by declaring the alarming statistics of how disproportionately represented black Americans are with kidney disease. This bill calls for a kidney disease and educational task force that is made up of members of the state Senate and House. They will create a campaign advocating for minorities and children with kidney disease by hosting health education workshops, preventative screenings, social media posts, and radio commercials. Mental health disparities impact men as a whole because of the stigma surrounding it, but gay and bisexual men experience more mental health concerns than straight men. This likely stems from discrimination, minority stress, and other environmental and societal factors. Minority stress refers to increased stress that minorities face simply because of the discrimination and extra challenges that they face. They also are more likely to suffer from substance and drug misuse when compared to heterosexual men. Suicidal tendencies are another health disparity that impacts sexual minority men. Studies have shown that gay and bisexual men are more likely to have attempted suicide or have a plan to commit. As for the need of mental health professionals to discuss suicidal behaviors with their sexual minority patients and create culturally sensitive suicide prevention programs. The federally mandated Suicide Prevention and Crisis Line 988 includes special services that are catered to meet the needs of young people who are part of the LGBTQ community. In the late months of 2024, many states have enacted laws that prohibit insurance companies from discriminating against people based on sexual orientation and gender identity. Low-income men are more likely to be uninsured and less likely to have access to quality healthcare. Men with low incomes are half as likely to be covered by some sort of insurance due to their lower rates of employment and education. Due to these circumstances, these men are at a higher risk of having poor health. 1 in 3 low-income men are obese in the United States, and they report that they do not get a yearly checkup. There are certain requirements for childless and non-disabled men to be able to qualify for Medicaid depending on the state. The Affordable Care Act has expanded access to Medicaid and gives low-income men a better chance at receiving health care. Low-income men are also more likely to be working multiple jobs, which causes increased stress and does not allow for time to check on their own health. Men with higher income and job stability have access to their own insurance and time off work to get their routine checkup or address specific health concerns that may arise. The COVID-19 pandemic created a large increase in telemedicine because people were unable to physically go places like the doctor unless it was an immediate concern. Telemedicine is a convenient way for people to be in contact with health professionals without having to go to the doctor in person. This is beneficial for people who are not experiencing serious health concerns but still need to speak to a health professional. Certain studies have established that telemedicine services can be cheaper than in-person medical appointments. Telemedicine expands access to quality medical services by being cheaper and more accessible. Access to telemedicine may be decreasing in 2025 because Medicare will only cover certain telehealth services through March 31st, 2025. This is unfortunate because telemedicine services can help limit health disparities among men who struggle to gain access to healthcare. This will especially impact low-income men and men in rural areas who do not live near health providers. Telemedicine is also a good resource for men who have behavioral health concerns. With the stigma surrounding men's mental health, reducing access to digital therapy will leave many men without access to the behavioral health services that they need. Men's Health Network provides multiple resources for men to gain access to healthcare. Our website answers questions about clinical trials and how to know if they are safe, how to get a copay card to lower the out-of-pocket costs of prescriptions, and a list of different health programs to be a part of. Spreading awareness and supporting different public health campaigns is a way for the average person to get involved and push for policy changes. Helping these campaigns gain traction in the media and making men's health a household topic is an important step in emphasizing the health concerns that they face. When establishing an approach to addressing health disparities through policy, it should not be one size fits all. A general approach will not impact all communities equally. This is why it is important to develop strategic plans in order to successfully combat health disparities. What works for one community may not work for another. Some policy interventions can actually widen health disparities in communities. Some studies have displayed that downstream interventions that focus on change at an individual level are more likely to increase health inequality. An upstream approach, which focuses on social and policy change, has proven to be more successful in reducing the amount of health inequality. Addressing health disparities through policy should have multiple different approaches because different communities have specific needs. In this video, I addressed health disparities among Black men, sexual minority men, and low-income men. Different policies have been put in place that aim to limit the disparities these communities face, such as creating health campaigns and government task forces and establishing services that cater towards them. Expanding access to healthcare through telemedicine also helps to combat disparities in low-income and rural men. Thank you for taking the time to learn more about how policy can address health disparities in underserved communities of men.